Hi, I'm here to share some experience. So, less than 5 months ago, I woke up in pain, but otherwise pretty much normal life. Was going to work, exercising, really happy with that. Went to the doctors, had a brain scan. This is a long story short. Had a brain scan, then was called back to be told that I have a massive brain tumour around the size of my fist. And I needed to go to the hospital immediately. Went to the hospital, the brain surgeon told me that unless I had brain surgery immediately, I was going to die and die quickly, 100%, no guarantee, as in no guarantee of, not even a 1% or less chance of survival. I was just dead. The reason being, because the brain tumour was blocking the cerebral spinal fluid from dispersing naturally, a condition called hydrocephalus, which is basically a build-up of cerebral spinal fluid, would have meant instantaneous or close to death for me because the build-up was so severe. I then had a 9-hour emergency brain surgery to remove the tumour, after which I woke up in hospital in intensive care, unable to talk, unable to walk. I slowly regained talking. There was a lot of concerns about brain damage, etc., because it's very challenging to know how the brain surgery went until you see the recovery, because a very delicate organ, any sort of mishaps, I think of operation, is an instantaneous feedback. For the brain, unfortunately, it's not until the person wakes up and they perhaps have a different brain function, personality changes, whatever. There are many implications for brain surgery that are not discovered until the patient is conscious. So there was a lot of concern for me, which was quite frightening. I was very conscious and cognitive through that process, although I felt bewildered and confused by the drugs I was on. Hallucinations were a side effect. Would have been nice to know that before I had the side effects. Side note for doctors. Quite frightening for myself and my wonderful carers who stepped forward, and I have to say, without them I would not be here. I don't know where I'd be, but I definitely wouldn't be doing a video and feeling like I am now. And I guess that's a thank you not only to my carers, but anyone caring for anyone else. It's a real dedication that may not be, the benefits may not be obvious to you. It must be exhausting, all those things. I feel you have your own journey, and I thank you for it, because we would be nowhere without that dedication, without that care, without that love. Because the system, to me, my view is that the system is quite good in Australia, save for brain surgery, although no system is perfect, and those gaps can only be filled by, I feel, in the current system, by the love and care of others. And those gaps are the difference to me between a full recovery, a quick recovery, and those who don't. So then I wake up. The biggest impact to me was I couldn't walk, and talking returned much more naturally, which was great. The walking was frustrating because you think you can, but you can't. You try and stand up, and I wasn't allowed to stand up in the hospital, but I did my own research in private time, safely, I must say, and unfortunately I just couldn't stand up, couldn't control my limbs. I found a lot, especially initially in the hospital, my hands would work of themselves. So I remember thinking about it as if it was if your PlayStation controller, your computer game controller is broken, so you want the character to jump, and you're pressing jump, but then crouching or ducking. Similar to me, I would just whack myself, particularly in the head. I don't know why I aimed for the head, it was a bad move, but like I said, it was uncontrolled. And it was very frustrating because you're whacking yourself in the head, and little things like having long fingernails meant I'd scratch myself. Very frustrating. I wasn't allowed to, I couldn't cut my own fingernails at the time because, as I said, mobility was limited, and the hospital was not allowed to cut my fingernails. So I found that a significant risk and something I had to overcome, because it was a genuine challenge to not, I could not stop myself doing it, so I have to control it with other measures. So wear protective clothing for myself, funnily enough, or just other little things to balance, pardon me, to balance out my condition and my recovery, whilst not make any permanent changes. So I eventually kept working that way. So from not walking came to standing, from standing came to being able to get into a wheelchair, mobility increased in the wheelchair. God, that was an insight that I honestly recommend, as hard as it is for others to go into a wheelchair, just to experience what it's like. And it's very different, very different. Countertops are different sizes, switches are in different places. What was previously easy to access or egress from, no longer. It really changes the way you see the world, and it's just a simple change. And a wheelchair is a massive step forward when you think about it. So from the wheelchair I progressed to walking slowly, which is great, and now to the point where it's less than 5 months, and as you can see, I'm walking much better. I've been exercising and rehabilitating. I'm hitting the gym, which I'm really proud of, because it's been a long and slow journey over 5 months, and 5 months is ridiculous. I've been told medical miracle. I've been told that already after 4 months my physio said I was the best recovery he's ever seen in 20 years. So that includes all the time they've had to get better, and that's only after 4 months. So I'm very thankful, but yet I describe it as a long and slow journey, because it feels, that's the difference. Time now has a new meaning to me, because life one, pre-brain, when I had the brain tumour, feels so different to life two now without the brain tumour. And I'm wondering how I'll progress. Perhaps this whole time effect may not continue. I'll continue to monitor myself and see how I evolve, because as I say, I feel this is a life too, and I'm open to it. So I'd like to share that with anyone who's going through something similar, who knows anyone, and even if you have never, I think it's a powerful message, because I'm fortunate to share this message with you now, and I never thought I would. I never thought I'd need to. I had no idea I had a brain tumour, but I did, and I'm working with it. I'm very, very happy to be in life too, and as I said, it's not just me, it's thanking the many medical professionals, friends, family, loved ones, everyone contributed, even those who just sent me a message, helped me beyond belief. A lot of friends wanted to see me, and it really was counterproductive for me, because I was so focused on my recovery. As you can see now, this is why, because I felt I could return to a very able-bodied life very soon if I focused. I did focus, but that did mean some hard decisions, because I did want to see people. Of course I want to see them, everyone likes that. But I only have so much time. I was sleeping a lot more, so with that time I had to choose to do what was best. And what I felt was best for the long-term recovery was to focus on rehab, a lot of hard work. Thank you for listening.